In today's video, we're going to be going over 10 symptoms of low blood sugar. A couple of weeks ago, I did a video on high blood sugar or hyperglycemia, and today we're going to be looking at low blood sugar or hypoglycemia. In my previous video, I discussed some of the severe consequences of leaving high blood sugar untreated, which include kidney failure, nerve damage, and even death. But having low blood sugar can be just as dangerous. So in today's video, we're going to go over what causes low blood sugar, 10 signs you might be experiencing it, and what you can do about it. Hey guys, welcome back to my channel. If you're new here, my name's Kate. I'm a health coach and I post videos on a high-fat, nutrient-dense way of eating. If you like this video, please give it a thumbs up, feel free to share, and make sure to subscribe. And make sure to follow me on Instagram, Twitter, and Facebook where I share new posts every single day. Today's video is sponsored by Squarespace. For everything from websites and online stores to marketing tools and analytics, Squarespace is the all-in-one platform that does it all. Head to squarespace.com/healthcoachkate to start your free trial today. As I mentioned at the start of this video, having low blood sugar is not something to take lightly. In the most severe of cases, it can result in death. Usually, the level of glucose in the blood considered to be too low is anything below 70 milligrams per deciliter or 3.9 millimoles per liter. But with that being said, some people can have readings below this threshold without having any symptoms. However, when it gets below 54 milligrams per deciliter or 3.0 millimoles per liter, that is when you want to take immediate action. We're going to start off today talking about the two types of hypoglycemia, then we will get into the 10 symptoms, and we're going to finish off by talking about what you can do to prevent hypoglycemia from happening. Reactive versus non-reactive hypoglycemia. There are two types of hypoglycemia, reactive and non-reactive. Reactive occurs when your blood sugar drops a couple hours after eating a meal, and non-reactive is not always diet-related. Non-reactive hypoglycemia, also known as fasting hypoglycemia, is commonly seen in diabetics when they overdose their insulin. And there are other medications that can cause it, either intentionally or unintentionally. Insulin, of course, as we just mentioned, metformin, and certain types of antibiotics can all cause blood sugar to drop lower than it should. Excess alcohol consumption can also cause a drop in blood sugar. And if you have kidney, heart, or liver issues, this can also be the cause. But reactive hypoglycemia can be seen in those who are not diabetic and who do not take medication. And reactive hypoglycemia can be a bit tricky to diagnose. As I touched on earlier, the numbers are not the same for everyone. Some people can have blood sugar levels that are considered to be low and not experience any symptoms. And on the other side, some people can have blood sugar readings that are considered to be normal, but be experiencing all the signs of hypoglycemia. And this results in the diagnosis being missed. Someone might be experiencing symptoms, go to their doctor, and have their fasting blood sugar look normal. But because reactive hypoglycemia happens after eating, this test isn't able to identify the problem, which is another reason why it gets missed. But anyways, of course, if you are experiencing these symptoms, the first thing you should do is check your blood sugar if you have a reader at home. They are relatively inexpensive, and I will link a few that I recommend in the description box down below. But I'm going to reiterate this, hypoglycemia is not something to take lightly. So you should definitely book in with your doctor ASAP. But with that, let's get into the symptoms. Number 1, a rapid heartbeat. The first symptom we're going to talk about today is a rapid heartbeat or heart palpitations. When blood sugar drops below what the body requires, this symptom is very common. So if you notice your heart is beating faster than normal, or it is beating irregularly, this could be a sign you are experiencing hypoglycemia. Number 2, shaking. The next symptom is shaking and trembling. When blood sugar drops, the body will release certain hormones in an attempt to bring it back up. These hormones include the fight or flight hormone adrenaline, which might cause you to shake. Number 3 is sweating. Sweating is another sign of low blood sugar. And again, this is related to the hormones being released in an attempt to bring blood sugar back up. Number 4, anxiety. Some people who are hypoglycemic experience anxiety. Low blood sugar causes the central nervous system to malfunction, As we already mentioned, there is an acute increase in adrenaline, and this sudden influx can cause you to become anxious. Number 5, blurred vision. This side effect can be very scary if you aren't aware of what's going on, and even if you are aware, it can still be very scary. Our brains are particularly sensitive to drops in blood sugar, which can impact our vision. Now, whereas with high blood sugar, the eye itself can actually become damaged, with low blood sugar, changes in vision are due to how hypoglycemia affects the brain. Vision will return to normal when your blood sugar does. Number 6, confusion. Another symptom of hypoglycemia is confusion. And again, this comes down to a lack of glucose getting to the brain. You might have trouble thinking clearly or become forgetful. Number 7, irritability. Low blood sugar can also impact our mood. When it drops, we can see our mood drop as well, and we might become irritable as a result. Number 8, trouble concentrating. Once again, this has to do with the brain. Your thoughts might wander, and it might be really difficult to focus on your work or the task at hand. Number 9, extreme hunger. If you experience extreme hunger either right after you've eaten or a couple hours after you have eaten, this can be a sign of low blood sugar. Even if you check your blood sugar when you are experiencing this, and the reading is what is considered to be normal, this can still be a sign. What could be happening, if that is the case, is that your cells are malfunctioning and not able to take in the glucose out of your blood and use it for energy. So basically, your cells are starving, despite there being enough energy in your system. Number 10, headaches. And the final symptom we're going to talk about today is headaches. Once again, this comes down to the brain not getting enough glucose. Now, before we get into what you can do to treat hypoglycemia, I'm going to take a quick moment to tell you about today's sponsor, Squarespace. It is thanks to companies like Squarespace sponsoring my videos that I am able to put out as much free content as I do. So whether you need a website for your business, for your side hustle, or for personal use, Squarespace has got you covered. Their platform is incredibly easy to use and has a wide range of features for all of your needs. Their built-in search engine optimization tools make it more likely that your website will show up in search results. And not only that, but it will show up for the right people. SEO is so important for growing your business because if potential customers can't find your business, how are you going to grow? And like I said, Squarespace has all of these tools built right in. Head to squarespace.com/healthcoachkate to start your free trial. You don't need a credit card or anything. You can build your whole website, and when you build it and decide to launch, make sure to use code HealthCoachKate to save 10% off your order. Thank you again to Squarespace for sponsoring this video. Treatments. So what can you do to treat hypoglycemia? The first thing you need to identify is if you're experiencing reactive or non-reactive hypoglycemia. In the case of non-reactive hypoglycemia, the answer is pretty straightforward. Address what is causing the drop in blood sugar, aka too much insulin, and adjust accordingly. Now, with reactive hypoglycemia, which is what is often seen in people who are not diabetic, it can be a bit more tricky. You might eat a meal in carbs, which you would think would raise your blood sugar, but experience hypoglycemia symptoms shortly after eating. So what's going on? Reactive hypoglycemia is one of the earliest signs of insulin resistance, prediabetes, and type 2 diabetes. All of these things go hand in hand. As someone becomes more insulin resistant, their ability to produce the right amount of insulin to regulate blood sugar decreases. For someone who has hypoglycemia, here's what happens when they eat. Their blood sugar rises and insulin rises, but it rises too much. So because there's too much insulin, then too much sugar is taken out of the bloodstream, and you are left with low blood sugar and the symptoms we discussed earlier. The treatment usually prescribed to someone who's experiencing hypoglycemia is to eat more carbs, at which point you have fallen into a vicious cycle where you're trying to consume just enough carbs to bring your blood sugar back up. Dealing with hypoglycemia in this way is a nightmare, really. If you are ever somewhere where you don't have access to carbs or to food in general, that can be a pretty scary situation. The good news is that by addressing the root cause, your body's increasing resistance to insulin, you can stop hypoglycemia from happening. The key is to focus on improving insulin sensitivity. And I'm not going to go into how to do that today because I have so many other videos on this topic. So definitely check out this video afterwards. I give you 3 super simple steps you can take to start improving your insulin sensitivity, reversing your insulin resistance, and preventing hypoglycemia. Anyways, guys, that's all I have for you today. So to quickly recap the symptoms, number 1, a rapid heartbeat. Number 2, shaking. Number 3, sweating. Number 4, anxiety. Number 5, blurred vision. Number 6, confusion. Number 7, irritability. Number 8, trouble concentrating. Number 9, extreme hunger. And number 10, headaches. Let me know in the comment section down below if you have ever experienced hypoglycemia and what symptoms you experienced. I love hearing from you guys in the comment section, and I try to get back to every comment that I can within the first couple of hours after I post. So even if you just want to say hi, that really helps my channel. It shows YouTube that you enjoyed the video and that it pushes it out to more people. So if you leave a comment, thank you. Another thing you can do is share this video with a friend or family member who you think might find it helpful. I always appreciate that. And remember, if you guys are looking to build a website, make sure to check out Squarespace. I will put the link to check them out in the description box down below. Thank you guys for watching. If you did enjoy this video, you might also enjoy my video on how to reverse insulin resistance, which I was talking about earlier. I will put it right here. If you want to catch up on my most recent upload, you can find it here. And if you want to check out my keto diet and carnivore diet coaching programs, you can find them here. Thanks guys, I'll see you next time. Bye.